do both. I think insurance companies ought to be able to sell anywhere they want to sell. There should be no reason why you can't purchase health insurance that suits what you and your family want from any healthcare provider. And I think that that's good. And I don't know why. I think you're absolutely correct. But I don't.
That in the bill.
Yeah. Yeah, because when you go into the exchange, you can sell.
That's not.
I'm sorry. What did you ask?
Does the bill just drop regulations to allow a small company in Connecticut to offer insurance to someone in Illinois?
Yes.
Regardless of what the regulations.
If you go into, yes, but if you go, you have to go into the exchange, which I think most insurance companies would want to go into the exchange.
When they go into the exchange, do they have, everything has to be government approved?
No.
To be in that exchange?
No, there's just a set baseline policy that you have to have, and what that would be waiver of pre-existing conditions, not being able to drop somebody if they have a claim, and the other third major thing would be if you authorize the claim, you pay the claim. The rest of it is totally up to the insurance company with what type of care. It would be, if, for example, I think the best way to explain it would be currently, everybody thinks this is a Cadillac version in the public option. Every collective bargaining unit that has a contract right now with healthcare, and every retiree has a much better policy than the exchange is going to be. So people ask, well, what about the unions and their retirees? There's a base, what we're talking about is a very baseline policy here. Now, again, if you want more, if you want chiropractic, if you want additional dental, it's similar to what you have now. But we're just asking the insurance companies to get into the exchange, that want to be able to do business with people, and that's why the co-ops, I think, are important too. It's all about choice, really. And it's all about, insurance companies should be able to sell from Connecticut to Illinois. If you can get a good health care plan that will pay the kind of, and you're happy with the premium, will pay the benefits that fit you and your family, that's the way it ought to be.
I'm sorry.
No, go ahead.
If the exchange forces, and I agree that pre-existing conditions shouldn't be a reason for denying insurance, but once an insurance company then agrees to that in the exchange, isn't that going to increase premiums?
No, because what you're going to have, again, part of the reason that the premiums are high, and I really believe this, is the incredible cost that they have to pay out for claims when they pay them out. A lot of it is because of the administrative part of the health care that we talked about, and $130 per month on an average premium for everybody here that has private insurance is paying for people that don't have health care now. So I really believe that by putting pre-existing conditions and waiving that, I mean, it doesn't do any good. It's like having an automobile policy that says if you get in an accident, we're not going to pay. I mean, what's the point in having it? I mean, you would drop your insurance. If you knew your car, for example, if you knew that your car insurance, no matter what, if you got in a wreck, it wasn't going to get paid, why would you send premiums to the insurance company? I mean, you'd be wasting your money. Well, the same thing is true with your health insurance provider. If you know, if this woman that tried 25 companies and got turned down, but some companies will pick you up. They'll pick you up. They just won't pay the claim. And they'll say it's because if you have a heart problem, well, look at all the different complications that diabetes has for people. You know, there could be heart, circulation, could be a number of things. And those that do will just deny the claim. So here you are paying these insurance premiums, and when you need them the most, they tell you they're not going to pay for them because it's a pre-existing condition. So you really, in effect, have no insurance policy. You're just paying premiums for nothing if they don't pay the bill. And that's all we're trying to do here. Ma'am, you had a question?
Yeah. Well, I had if I can tell you what that name.
Sure.
I had cancer at the age of 5, and some of the medication that was used, they told my mother when I was given it that as I got older, there would be damage done to my legs and arms. And I was also given radiation, and now where they use pinpoint. Basically, it was wide angle then. You just kind of sprayed at the area with the radiation, right. Basically. So now I'm an LPN. I've worked as an LPN for 17 years, 2 jobs at a time, a lot of the time. And now I'm physically unable to work because I'm physically unable to stand up and hold other people's weight. I can't be up for long periods of time like that. I never know when my legs are going to be swollen, my feet are swollen to the point where I can't wear shoes. I'm in the process of filing for disability. I went to public aid, requested a medical card to help me pay my bills, my medical bills, so I could see my doctors, and I need to see and get the medications that I need. I was told that I didn't qualify because I don't have a child. If I had a child, then I'd be important enough to have a medical card. This plan won't have it so that a person without a child can't get help, or you're not worthy of having coverage. I'm in the process now of them deciding whether it's medically necessary for me to have a medical card. But I have doctors, I've had surgery since I applied for it. I now probably have another diagnosis that's going to come up, which I'm scared to death, is a hernia. Who's going to fix it? If I don't have anything, I have no job, I have no income. And basically, if it wasn't for my family, I'd be homeless.
If this bill, the House bill, again, I don't know about the Senate, the bill we have, what you'd be able to do, would you be able to go into the exchange immediately upon when this bill when it becomes effective. You would be able to go into the exchange. If you had no income, the government would subsidize the premium until you had income, whether it was disability income or whatever. You waited 2 years, you were saying. Now, nobody gets wealthy on Social Security disability or on. But in essence, the government would charge you 5% of whatever your Social Security disability was when you got it. So let's say, for example, it's the same thing if you made $50,000 a year, and you wanted to go into the exchange. Your premium, I think the math for me is about $220 a month if you make $50,000 a year to go into the exchange. If you make $200 a month on Social Security disability, I don't even know what that is, 5% of that, $200 a month would be the premium you would pay to be in the exchange. And that would give you a policy very similar to a standard Blue Cross Blue Shield.